service that's provided. Psychosocial care is something that complements the service that is provided in the hospitals. We take care of the children's bodies and their illnesses, but there is that component that also needs to be addressed. So we need to take care of allaying the fears and the anxieties that children go through. So it's very unique in that we work with children with very special illnesses and at the same time providing a specialized service of addressing these specific concerns that need to be addressed while their other concerns are also being addressed. And I also like with psychosocial care that we deal with the patient, but we also deal with the other individuals who are affected by illness or who are affected by the hospitalization. We're very family-oriented, that we believe that if one member of the family is hit with illness, there are effects, there is an impact on the entire family. And psychosocial care is also important for the family because it is they who have very unique responses also to illness, and it is they who have the responsibility of caring for the patient. And it's very important to provide that psychosocial support to help these families and these patients cope better with their experience. First thing that's very challenging is it's actually not very easy to define psychosocial. Like when people hear about I work and do psychosocial programs for children and for families, what does that mean? And it's very hard to define in like one sentence, but as a practitioner, I understand the impact it can have on a patient and a family, but it's very hard to define it for a doctor who wants it explained very quickly or for people who have no background in these kinds of programs. So it's hard to define what it is, and it's hard to validate the value of such a program. I recognize the importance, but it's very hard to communicate, or maybe it's a little bit difficult to encapsulate what it really means in a very simple but very meaningful way. Another difficulty is psychosocial programs are not exactly integrated into the hospital system. Like I work for a foundation who is externally engaged by the hospital, and so we come into the hospital but are not fully integrated as part of the hospital structure. And that poses some challenges in terms of the sustainability of the programs or in terms of the acceptance and understanding of what we do in providing psychosocial programs to the patients and the family. So it's really, one is really it's part of the structure, and it's really establishing the value of psychosocial care that can come in many forms. Like on the level of the hospital, it's having doctors or nurses referring patients for psychosocial care, understanding or having that awareness that the patients need to be treated, their illnesses, their physical ailments, but also the psychosocial components of being sick, of getting stressed, of having all these fears and misconceptions, that these need to be clarified also, because these will have an impact on how, on the health-seeking behavior of patients and of their families. So it needs to be better understood. And if it's under the hospital and if it's more integrated, then hopefully it helps sustain the program more. And so there on the hospital level, it's really referrals. And then on a larger scale, it's also having standards for psychosocial programs, because right now it's unique because it will depend on which hospitals have the programs, who is providing those programs. So it would help if there were some standards and some really guidelines in what is essential in having a psychosocial program, what needs to be in place. Like in the experience of the foundation, we found that it really will, the programs will fly if really it is full-time, if there is a staff and a space that is fully dedicated for psychosocial care. Because if it overlaps with other functions, or if it overlaps, or there are other concerns that are at the same time being addressed, it kind of muddles the program a little bit. But if focus is truly given to psychosocial care, then the impact of that can be better felt. I really am a great believer in psychosocial care. I really appreciate, how it helps children, how it helps parents who need to take care of a child with cancer, how it helps, people going through a difficult time of not just, coping with, having to deal with bad news of being sick or not knowing how long you have to live, but it's also, it's trying to balance everything, that there's also how will I afford the treatment, how will I go to the hospital, how will I feed my family at home, how will I take care of this sick child. And it's all these many different dimensions that we don't see all the time, and it's giving attention and recognizing the importance of looking at this in a very, in a more complete way, so that we can also respond more appropriately. And this appropriate response is what we see in the provision of psychosocial care. So it's really, it's something, go psychosocial care. It's something that we really need to have, and it's really supporting each other. Now, we support the medical community, we support the local government, we support the different groups and organizations doing other work, and in coming together, we are able to help more patients, we're able to help more people in more meaningful ways.